lectures they are missing. The reason is that our lecture was starting at 10:30, right? And university lectures, they were also at the same time. And so that's why we were getting quite less presence. See, right now, we have just started and we are 42. Since few days, it was seen that the presence was dropping very sharply. And you don't attend any university lecture, okay? But you should really attend. ऐसा तो है नहीं, करना तो पड़ेगा. I mean, there are some universities who have started it. Like I think GAU has started. Georgian American University has started. But this timing, right, the evening part, this should be good for everyone. Now today's session will be like, as I was telling you, I'll be speaking only for some time. Baki, it will be you who will be diagnosing the whole thing. Say one email, true, when you said that, yes, do you have to remember so much into that Kabira system and everything? Now, just after 5 minutes, I'll be showing you a trick. You'll be able to diagnose it. I am keeping the limit of 30 seconds, right? 30 seconds. Within 30 seconds, it is like a written guarantee. 30 seconds and you'll be able to diagnose. And precisely, it's without any error. So it would be that easy. You see how our brain functions is. One thing is knowing about it. I could have shown you this particular trick right in the beginning. So that way it would have become easier for me. But then for rest of the life, you'll keep on wondering that why over there that AVR is coming and why this is 2 and why this is 3, all those confusions. Because you know the basics very clearly. So today's session is like how to diagnose quickly, because that is also important. Just wait for a minute or two and then we start. From next time, so though it would be not next time, it should take some time. I'm thinking of teaching you echocardio. From USMLE perspective, from MBBS perspective, no one in the world can ask you about it. But if you really know this now, it will open a very different perception about heart and about the entire body. So these are the things which we'll keep on learning. Maybe I think we can take 10 sessions on that. But I would like to have at least 1 or 2 sessions. Similarly, 2 sessions on MRI, 2 sessions on CT scan, 2 sessions on ultrasound. Ultrasound, to as will proceed, I'll keep on showing. But when you know these things in first MBBS, though it is said that yes, when you come to final MBBS, there could be a radiology round, kuch samajh nahi aata. Seriously. I mean, don't feel bad, but when it is the screen and the radiologist would say, okay, see, this is the liver, this is hyperhepatitis, and you say yes. Right? Exactly the same way, histology में, हमारे साथ तो वही होता था. मतलब histology में teacher is showing मतलब their like slide and see, right, this is squamous epithelium. And you say yes. क्या कुछ पता नहीं चलता था. Because when the marker was put, when there are 10 students watching it, किसी ने खिसका दिया तो then there is no concept. Confusion था. So that's the reason that when we shall be learning the histology. So I told you about that trinocular microscope is there, which is connected with Carl Zeiss's camera. You'll be watching the real slides, and then same thing will keep on putting it to 10x and 40x and 100x and oil immersion. We'll keep on doing so that you actually know the difference between the cells, importance is pathology. Because when you know that normal part well, so then pathology will become very easy. Otherwise, literally pathology, लोग भागते हैं. It is such a complicated thing. And pharmacology, मतलब इतना रट्टा मारना पड़ता है. Right? No, it is not true. You'll be able to understand everything easily. So I think it's time. Yeah, enough. 93. So let's start. We start with, as I said, the promise of 30 seconds. Right? Just pay attention for 5 minutes, and after that, right, I'll be writing only on these 2 pages, and then all these ECGs you will be diagnosing. 30 seconds will be the time limit. Within 30 seconds, you have to answer. Right? And today, I really expect that everyone has to participate. Right? Because today it is like a game. Okay? Ekdam mast. It would be like a game. So let's start. As the ECG comes in your hand, right? Today there is practically no theory. Everything is practical. Right? So that's why I said it is like a game. ECG हाथ में आया. First thing what you will do, what you have to do is the heart rate. Right? Heart rate, you know it very well, right? 2 waves, two consecutive waves, right? So either 300 divided by big or 1500 divided by small squares. Right? You know that, and then you calculate. The second thing comes. Immediately the axis deviation, whether it is a normal or it is a right axis deviation or it is a left axis deviation. Now, if I say this has to be done under the 30 seconds, right, this is a trick. Right? And the trick is such, you have to remember only once. So this part is known to you. I'm erasing it. Right? This is known to you. On one page, we'll write only this much. Achha, you'll be writing this thing along with me because you will enjoy. Right? So in your notebooks, start writing. Take one page and write normal like this. Like this. Now you know that as soon as for the axis deviation, we need to see 1 and the AVF. Correct? 1 in this direction and AVF in this direction. Okay. So write normal like this. Right? Write the normal like this. So when you write normal, right? So can we say it like this is 1, this is 2, this is 3. And this L is left. So this will always remind you of 3, and this one is L. So whenever 1 is plus, and I'll give you enough practice, right? So right now, just understand, right? So when 1 is plus and AVF is plus, so what do we mean by 1 is plus and AVF is plus? Right? Those deflections, right? Those deflections that you see. Even we'll see several examples. So when they are plus, that means axis is normal. When the axis is normal, kuch means straight away normal, so it is 3 and L, right? So 3 means you're dealing with lead 3, right? So you are smart enough, you know that, right? 3 ka matlab lead 3, and L matlab AVL, right? So that is fine. When this 3, this is just for a reminder, right? 3. So 3 was parallel to someone, correct? And that's why we were watching 3. Right? 3 was parallel to someone. So this was 2, this was 3, right? So the distance was 60 degrees, 60 degrees. It was parallel to this, right? And that's why we were calculating this 90 degrees. So this is nothing but 30 degrees. All theories sub, right? 3 to plus 30. Plus 30. And this, the only option which is left out is plus 60. Right? So it means the moment it comes to 1 is plus, AVF is plus, so then what you have to do, you have to just go for lead 3 and lead AVL. Correct? Lead AVL. If lead 3 is isoelectric, right? this has to be isoelectric. Whosoever is isoelectric, because only one of them would be very much isoelectric, right? And if it is isoelectric, then matter is closed, right? And you know, chalo. If this thing looks confusing, let's see one example. Yeah, let's see, right? 30 seconds. We watch 1 and AVF plus, right? This is plus. So that means it is normal. If it is normal, so then we have to watch lead 3 and lead AVL. Kahan hai? AVL is here, lead 3 is here. Yeah, this is done. That means this, it is plus 60. Right? AVL, done. Bas, see, you have started answering. Right? This is what you have to do. Easy. Right? We'll understand this technique for all the things. RA, right axis, left axis. But this you could figure out. Right? Okay. Again, no problem. Don't worry. I that's why I'm taking time. Right? But this is the speed at which you have to do. कोई बात नहीं. This is whenever you have to go for axis deviation, this is 1, right? Lead 1 and lead AVF, right? Both are plus, right? Both are plus. So when both are plus, so it means it is a normal axis. So far clear? Right? Because every time we are just watching lead 1 and AVF foot, right? 1 and AVF. So that is done. And as we discussed, that whenever it comes to normal, so this is 1, this is 2, this is 3. So that means we'll be watching lead 3. And normal was ending with L, so that we don't have to remember it. So it will be AVL. Out of AVL and out of 3, which one is isoelectric? Out of 3 and out of AVL, which one is isoelectric? Isoelectric is deflection up and deflection down are same. Which one? AVL, right? AVL, correct? So if this is, then it is plus 30 degree. If this is, then it is plus 60 degree. That's it. So this is straight away you watch it and in 10 seconds you say that there is no axis deviation and the heart's normal axis is at 60 degrees. So far clear? Is this much absolutely clear? All right. Even if there is slightest of doubt, just let me know. If it is clear, great. Okay, sure. Answer. Once again, wait, this was no problem. I'll take once again. Rishabh, you tell me the steps. I hope everyone has attended previous lectures. What if either AVL or 3, either of them will be definitely isoelectric. In case if there is any variation, I'll show you the variations. But something which is very standard, first learn that. Variations will surely see. For axis deviation, these are the principles. First, you have to watch 1 and AVF. Oh, if anyone has missed this theory part of it, तो भी कोई बात नहीं. चलो, remember this much, right? इतना सीख लो तो भी you'll be able to diagnose. Then you have to learn the real theory behind how this axis works. Yeah. Right? So, because you need to know Kabera system properly. Anyway, so this is 1 and this is AVF, right? Last time, ध्यान से. These are the two leads which are seen for axis deviation. So here it is lead 1, right? Here is lead AVF. You have to just watch whether it is up or it is down. Or if it is like this, so then it is more up on the plus side. But that is what you have to understand, right? Because it is the resultant flow of current. So this is plus, beyond doubt it is plus, and this is also beyond doubt it is plus. When both are plus, right? That means as per the Kabira system, you are either here or here, because this is the zone. This is the plus plus zone. This is the plus plus zone, right? Where this is 30 degree, this is 60 degree. Done. So you just, by looking at it, you know that it is normal. Then, as I told you, you'll write N like this, so that it reminds you that we need to watch lead 3 and lead AVL. Watch it. Lead 3, right? Lead 3 and lead AVL. Which one is isoelectric? जितना deflection ऊपर उतना deflection नीचे. So clearly this is the thing, right? So this is AVL. So that's the AVL. AVL is plus 60. Had it been 3, then that would have been plus 30. Correct. So this would be the procedure. I'm erasing it, right, so that you can practice it. Or I have already put one clean file also in which there is, so you can even practice on that. So no, I'll keep this thing as it is. So now calculate this. Yeah, calculate this. Can't see lead 3. Okay. How could it be right deviation? पहले तो ये बताओ. Shweta, those the men I'm telling you, lead 1 and lead AVF. Acha, chalo, don't worry. This is like as such when we talk about AVR and this, it is not clearly showing you the signal, right? It is not clearly showing you the signal. So let's go back. Let's go back and learn rest of the things, and then we'll combine everything. So that's how it will be still more interesting. So next one. So this is normal. Now we are left with two options. Right? Left axis deviation. So when it is left axis deviation, so left, that means it will be lead 2. And lead AVR will always be used. Right? If it is not normal, you'll definitely be using AVR. Okay? So L is for number 2, less alphabets. This is minus 30 and this one is minus 60. Left axis deviation left axis deviation, when we draw it like this, it would be over here and it would be over here, right? Because then and then, this is for, and for the left axis deviation, this, we just go for 1 and AVF, right? So in left axis deviation, this is plus and AVF is minus. And AVF is minus. So it would be either minus 30 degree or minus 60 degree. And we see it like when it is minus 30, so it would be lead 2. And when this would be the AVR. And for the last one, that is the right axis deviation. The right axis deviation. So how it will be? It will be just the reverse. So this will be the 1 and this will be the AVF. This is minus, this one will be plus, correct? Because things will be now falling into this zone. So when it will be into this zone, so for 1, right, this was plus and this is now minus. So here it will be 1 is minus and AVF is plus. So that would be the right axis deviation. This was 2R, right? 2R, and this one will be reverse. It would be R2. So practically speaking, we are watching the same beats. Right? So over here, it would be this and this. So here it would be plus 120, and this one would be plus 150 degrees. Right? 2. So here, this would be plus 120, and this one would be 150 degrees. Correct? So that's, so in nutshell, all you have to do, watch for 1 and AVF, right? This would be our action plan. If it is plus, so that means we are talking about normal. So in that case, we'll be watching lead 3 and AVL. Okay. And if this will be plus 30, this will be plus 60. If they are not plus, then it could be either left axis deviation or it could be the right axis deviation. If it is left, L, so how will we detect that it is L? Because this would be the plus, minus, right? We are dealing with 1 and AVF. Right? We are dealing with 1 AVF. So this would be plus and minus. In this case, L, that is 2, R is always present. Whosoever is isoelectric, right, this would be minus 30 because it would be lying into this quadrant, right? This quadrant, left axis deviation. And this one would be minus 60. Right is reverse. So we just write R and 2, same leads we are watching, but this time it would be falling into this quadrant. Right? So this would be 120 and this one would be 150. This is like a cheat code, right? And yeah, it will be minus plus. Now let's do it. So far clear? As we'll do. Watch this. The moment it comes in, watch 1 and AVF. Yes, this is plus, this is minus. That means we are dealing with left axis deviation. Right? Left axis deviation, so that means it is 2 and R. So here it is 2, right? Here it is 2 and here it is R. R definitely looks isoelectric, so that means we are dealing with this. That means we are dealing with minus 60 degrees. Done. Right? Removing it. It is, right? Now do it by yourself. Though you know the answer, but still you have to understand it. Right? If there is any doubt, let me know. But just after 2 or 3 examples, then you will start calculating diagnosing by yourself. Even if I have done it, but can you do it by yourself? That's more important. And do let me know, because there is only one answer. So at times I get confused whether you have really understood it or not. got it. Yes. Nice. Nice. Which leads to watch. ठीक है, कोई बात नहीं. See, I don't mind you ask me 10 times, right? Without, मतलब बिल्कुल बेशरम होके questions पूछ लेना. Without thinking. I'll not take your name. So that you can always ask boldly. Which leads to watch. ठीक है. 1 and AVF. पहले देखो क्या है. This 1 is what? Plus. AVF is what? Minus. Correct. So plus minus, this means we are dealing with what? We are dealing with, right, LED. So L matlab 2, this is 1, this is 2, so lead 2. Right? R is always present, so R. So what's the lead 2 and what's the lead R, out of which one is isoelectric? Yeah, do reply. I'm waiting. Okay, this is lead 2, this is lead, so this is lead AVR and this is lead 2. AVR, right? So this is AVR. So when it is AVR, one is here, one is here. So 2 in this order only, right? 2 is minus 30. So this one is minus 30, R is minus 60. So now I think you have understood it. Correct? Great. Chalo. You have understood it. So let's move on to the next one. ये तो already किया. Yes. Answer. What degree? Correct, correct. All of you are, yes. Tanvi, Khushi, Durgesh, Swastika, Shavani, no. Watch again. There's 1 and ADF. 1 and ADF. Akshat, देखो, this is positive. ये जो है, is this positive? Achha, those who have already given the answer, give me the. That's right. So give me the degree also. Start working on that. Okay, there are 4 or 5 answers who are telling normal. See, watch for this. This is the baseline. It's plus side more or minus side? Minus side more. Okay? So minus side is more. This, if this is the baseline, plus side is more or minus side? Clearly plus sign. Clearly plus sign. When it is minus plus, that means we are dealing with right axis deviation. Okay? Right axis deviation. Those जिसने minus 30 वगैरह लिखा है, right? Just for them, we are dealing with this or this, है ना? We are dealing with this side, this quadrant, right axis deviation. Right axis deviation. So that means we have to watch for R2. Watch for R. R is over here, and 2 is over here. Which one is, now see the situation. Which one is less deflective, right? Less deflective means one is like this and second is like this. So this means this is more near to isoelectric. Right? This is more near to isoelectric. So whenever there is confusion, because what is happening is, this is a game. This is a game in which on one side, if there is a strong pull, so that means it is not isoelectric. Right? If on so this, in this case, AVR is less fluctuating. Right? It is almost near to the baseline. So we'll be selecting this. So when we select this, so that means this one is right. यहाँ पे 2 were there, right? Plus 120 and plus 150. So we'll be taking it this plus 120. That's right. And most of you have answered it correctly. don't worry about those who missed in this, right? We will be having several examples. Several. Chalo, one more. इसके अंदर तो गलती करने का कोई चांस ही नहीं है. This is a very classical. In fact, this is one of the exam questions. USMLE exam. And you'll find that itna easy. This is see who has answered. Deepnita Shabash. Are those एक minute. Now you have started. Here answer full with the degrees. Please everyone full answer full. Right? There are only few questions replies in which you are answering with the degrees. Which deviation and what degree? Please write both. Now you have started. Correct. Rishikesh, you are Kalakar. You wrote it in Hindi. Shabash. Query? Okay. Don't worry. See, let's solve this. So we have to watch what? This is negative, no doubt about it. Then AVF 100% positive. So minus plus, that means we are dealing with RAD. We have to just go for AVR and AV and AVR and 2. Clearly, this is the AVR, right? And because this 2 is too much of deflection, that means we are dealing with this. We are dealing with this. This is plus 120 degrees. No confusion. Done. AVR is 120, and if it is 2, had it been like this, instead of this, let's say if it could have been like this, and over here, if it could have been like this, so then we would have said that it is 150 degrees. Right? But right now, not. Right? This is isoelectric, so done. EVR is 120, V2 is. Okay. Chalo, solve this. Great. This is also very nice. Ekdam clear, koi doubt hi nahi. 30 seconds. Shabash, come on. 30 seconds. Very good. ऋषभ, यार देखो तो सही. हार्दिक, लेफ्ट है ना? लेफ्ट. श्रवणी, अरे मैंने आंसर बोल दिया. Here, don't write both the things. Be specific that if it is LAD and what axis, bus, that's it. Right? You don't have to write both the axes. Right? You don't have to write both the axes. Just write only one axis, which you say, because in your ECG report, you will be writing that this is a left axis deviation with the electric axis at minus 30. Right? That's how you write. So, let's see. This is lead 1. Most of you have answered it correctly. Right? Most of you answered. So, lead 1, and this is area. This is plus and this is minus. So, that means this is plus, this is minus. We are dealing with LAD, L. This is 2. And then this one would be the R. This means over here, this would be minus 30, and this would be minus 60. Right? So, lead 2, yes, this. Need AVR out of question, right? It is extremely negative. So we are taking this. Answer is this. Correct. Most of you. Acha. Wait. Need to. Hardik, plus 60 beta becomes this, right? Plus 60 becomes this now. Right? So take care of this plus and minus. अच्छा श्रवणी, why this confusion? RAD क्यों बोला आपने? Why minus 60 not considered? Why only one lead? Simple. Because when we say left axis deviation, right? So we have minus 30, minus 60. This is the heart. This is normal heart. When will be the left axis deviation? That is when the left ventricle has become so big, right? Left ventricle has become so big that its muscle mass has increased, so that it is pulling all the current in this direction. So electric axis is always in one particular direction. So that's why we need to define that whether it is minus 30, because if it is minus 60, that means the enlargement of the ventricle, that is too much, right? That is too much, correct? So it will be why did you choose lead 2? Okay. Watch this. That at least this part is clear. This part is clear that we have to watch lead 2 and lead R. So this is AVR and this is lead 2. We have to go for isoelectric. Isoelectric means it will be, right? No big logic, no big brain. Simple. Visually, upward deflection and lower deflection, which is almost same out of these two. Out of this and out of this. In which case, it is quite similar, right? Over here, though, there is no upward deflection. Hey, right? Here, it is somewhat, right? Somewhat. Thoda bahut, thoda up, thoda down. So that is quite okay. So that's why we'll select this. It is just a comparison, right? It is just a comparison. That's why we took this. I'll not take your name, but in your life, never feel like that. No, those who have answered incorrectly, so it's not so that they are dumb. Happens, yaar. You guys are fast. मुझे सीखने में तो बहुत टाइम लगा. It took me half a day to learn these things. You guys are very smart. Chalo. Now these are with some conditions, but you have to first answer this part. Then I'll show you so many other conditions also. But we'll discuss that. पहले ये फटाफट खत्म. Answer. Correct. Now you are correct. Shweta, दोस्त यार क्या करते यार? Right now I can't speak. Do it again. Which one is isoelectric? मुझे नहीं पता. मुझे आंसर चाहिए. अक्षर, आंसर. Give me the answer. Whether wait, why so many incorrect answers are coming? No, there should not be any confusion. Wait, I'm marking. This is lead 1. Which leads are you watching, guys? How can it be? This is lead 1. This is lead 1. And this one is lead AVF. At least right or left, mein to galti mat karo. Now you are. So this is minus. This one is definitely plus, na? So when it is minus and plus, that means we are dealing with right axis deviation. So that means we have to just go for R2. R2. important right side. So we are dealing with this quadrant. In this quadrant, right? So we have got two axes. So all those minus axes का तो कोई scope ही नहीं ना. Minus they go over here. So this will be plus 120 and plus 150 because यहाँ पे it will be plus 180. So we have to go for R2. So this will be R. This will be 2. So R2. Watch it. This one is R and this one is 2. So wonderful. So wonderful. This is the like classic book picture. Exact. मतलब 2 is like so beautiful. जितना plus up, no plus नीचे. So this is 2. This is 2. So that means we are dealing with this plus 150. Okay, Sharon, what's your question? How did you decide that R got 150 degrees? Okay, we need to go back to where we started. This is like a cheat code. Right? This is like a cheat code. Okay, I'll take the name also. Yeah. Why? Let's first finish this. The question is, how did you decide that when it is 2, so then it is 150? The technical reason which we have already discussed, but doesn't matter, right? Wait, I'll take it a bit fast. This is for all those who have got some confusion, right? I'll take this thing a bit fast. This is a Kabera system, right? This is a Kabera system. So when I'll draw and I'll keep on erasing it, right? So this is the Inthovans triangle. Inthovans triangle in which you take the right arm, and the left foot. Correct? Left foot. So this one is 1, right? This is 2. This one is 3. So when you project it on this, right? So this is the 1, right? This degree. So all these degrees, there will be 60 degrees each, right? So then from here, the 60 degrees. So this is the 60 degree. This is lead 2. Then from here, another 60 degree, right? So this one is the lead 3. So that's why, right? This is the Einthoven's triangle. So this is 1, right? So this is 1. Then this angle. So this angle, that is 2. And this angle, that is 3. Okay. So now we have got lead 1, lead 1, lead 2, lead 3. I'll change the color for rest of the limb leads. Next, we have got AVR, AVL, and AVF. So this is like in circle, right? So they are at the distance of 120 degrees each because it has to make a complete circle. So reason, this is AVR, right arm. This is AVL, left arm. And this would be AVF, that would be the foot. This foot is left foot, right? So thus, when we project this thing on it, so this becomes AVF, right? Similarly, this AVL, all the way from here, it would be like this, it would be like this, and it would be like this, right? So here we are having AVR, and this would be AVL. Right? The whole idea behind it is that when we say whenever there is left axis deviation, right? Left axis deviation. So, or what was the example? It was on right axis deviation, right axis deviation, right? It was we saw the example of right axis deviation, and that's how your question came. So that means in right axis deviation, we are dealing with this quadrant. We are dealing with this quadrant, correct? So in case of right axis deviation, see, I just extended it. Right? I just extended it, that AVL line. So for the right axis deviation, now if you calculate all the way from here to here, how much degree it would come up? This is 90 degree. and then plus another 30 degree over here. So this is 120 degrees. Right. Similarly, over here, this is 150 degrees. Right? Because this, if you consider, right, this is 180 degrees. So exactly it will match up, because this is like 30 degrees. And then there will be another one which will be at 60 degrees. Right? So now we have to just watch whether it is in this direction or in this direction. If the axis is in that direction, we have to watch someone who is perpendicular to it. This is the concept. This was the theory behind it. So that's why in case of right axis deviation, right, in case of right axis deviation, when our axis is going on this 150 degrees, who is 90 degrees? It is this one. It is this 2 which is at 90 degrees, right? So that's why when 2 is showing isoelectric, because 2 will be showing that the current which is going over here is coming and then it is going, right? So it is isoelectric. So this is the basic principle. This is the basic principle of physics. That's if this is the axis where the current is going, right? So someone who is watching it from the perpendicular plane, for them it would be the isoelectric, because current is coming and the current is going. So that's why all the perpendicular axis, they are watched. So that's why we are selecting this 2, lead 2, because it will be watching it from perpendicular. Similarly, if we really want to see this part, this axis, so then this axis will be watched by whom? In that case, we have to really extend this AVR. We have to extend this AVR, right? So this is minus AVR because the plus is on that side. But it will be 90 degrees, right? See, this is the 90 degree. This is 90 degree. So now we are clear that if we have to watch this, what is the activity which is going on 2, which is going on lead 3, then we have to watch AVR. What we did was we created a cheat code, right? This was the science behind it. But we said that whenever there is RAD for our brain, right, to remember it easily, we said R2. R matlab first this plus 120, because plus 120, this is 90 degree to this AVR. So this is plus 120. Second one will come automatically plus 150. And then we are just watching this. Got it? Shabash. Right? So this is the whole thing. Chalo, one more you will diagnose. Yeah, go ahead. Okay, I'll take the names. Yes. I'll take the names. Deepnita first, Khushi second, Eer third, Fez, Rishabh. All are right. Tanmay right. Yes. Rishikesh. Yes. Manasvi, just watch. No. Sorry. My mistake. You are right. Tanish, just check it again. Shravan, check again. One in areas, clearly minus plus. So we are dealing with RAD. RAD is R2. So AVR is this. Right? AVR is this. And this is 2. This is 2. 2 is looking good. So that means on the higher side. So this is plus 150. I got it. Perhaps you must have seen this too, but it's under confusion. Acha. Take it like this. When it is LAD, so it is 2R. Because L is written like 1, 2. So it is 2. When it is RAD, R for R, R2. Bigger numbers, right? So we are writing it like this. When it is left axis deviation and when it is right axis deviation, we have to just go for these two angles only, right? Chalo, ye baat hai. If it is, so this is, yahan pe it is 0, right? So we'll be going back minus 30. We'll be going back minus 60, right? So we are going like this. That's all. Right? So this is minus 30. This is when it is left axis. So when it is left axis, the first one means is minus minus plus minus minus means. I didn't get it. Acha. So minus minus. Acha, I got it what you are telling. Minus minus. Yes, this one would be the minus minus, right? I think that is what you are telling. That is possible. That is called as the extreme right axis deviation, right? And it is the very rare thing. Means in my life, I have not seen more than 10, 12 such ECGs in which there is extreme RAD, right? Because if it is extreme RAD, then the patient would be of pulmonary hypertension and will be very critical. So we'll see the pulmonary hypertension. But right, you got it. Chalo, shabash. Right, so done. So hamesha. Sir, why 150 again, not 120? So in this is R, this is 2, right? So in R, it is quite isoelectric, but when you compare it with 2, the 2 is absolutely right book picture. Na? It's the typical, chitna up, utna down, right? Over here, this is slightly more and this is less, right? You can even calculate. Yeah, so if you calculate, you'll find that this is not even 1 full square, while this is almost like a 1 full square. Right? So that's fine. Chalo, one more. Uske baad this is not conclusive. These are some special acts. Chalo, do this. Sorry, here AVF is not there. No. This is the tricky one. Go for this. Yes, Sharon. So many answers. See, you don't have to really force yourself कि नहीं बस deviation है ही है. There is definite deviation, right? If there is not much of that deviation, so that means it's normal. Yeah? See over here, right? There is slight minus. Yes, if you technically speak, yes, you can say minus. AVF, so it is almost isoelectric. When they are almost isoelectric, then the chances are that there is not much variation in up or down. It is normal. But yes, if you say that it is slightly deviated towards the right side, yes, you can. But when you say right axis deviation, that is R and 2, here R, right? No, here 2, to see neither R nor 2, they are conclusive. One is ekdam plus, another is ekdam minus. Right? So none of them, it is so much conclusive. So this is normal. The only thing is it is slightly less voltage. Let's go back to, now you have at least understood this part very clearly. Now we'll add something to this. Our next would be that is there any hypertrophy. So this part is clear. This part is all good. We need some space. That normal one, I didn't really check it. But see, both of them, they were almost isoelectric. So that means when they are isoelectric, it is that category. So let's start with now. You add one more component. Because see, the life is not in ECG. Right now, we have restricted our life to only this much part. This much part, na? This much. 1, 2, 3, AVR, AVL, AVF. What about these 6 ones? V1, V2, V3, V4, V5, V6. Now we'll involve them also. So that this will give you a 3D picture. Right? It will be giving you like a 3D picture. So here it is. They are called as the precordial leads. Right? They are precordial leads. Okay, the question you asked is that when it is normal, to then why to watch for this 3 and AVL? Because 3 is plus 30 degree and this is plus 60. Even if it is normal, so it could be like this or it could be like this. So this is what we really want to identify. Because what would happen is that when in case of, this is like a developing a habit. When it is plus 30, right? When you see someone's ECG, right? You see someone, now because this question is asked, think it like, you have got series of ECGs with you. One ECG which was taken when the patient was normal. So at that point you found that it is plus 30 degree, right? Now in such case, when this person develops pulmonary hypertension, you are watching the P pulmonary. I'll later explain you what is P pulmonary, but it is telling that the patient has developed pulmonary hypertension. Pulmonary hypertension, that means right ventricular failure. Right ventricular failure, that is right ventricle is struggling, so that means right ventricle would be enlarged. Right ventricle would be enlarged, so in that case, this axis would shift, right? But if it is the initial thing, what would really happen is that this axis would shift to plus 60. Now, though it will look normal, but the patient has developed the symptoms. Patient has developed the symptoms because he has got, for this particular patient, if he has got the left ventricular hypertrophy, so immediately you'll be able to see left axis deviation. Correct? But in case of right axis deviation, he has got this much area. When that much area is shifted and when there is right ventricle is so much enlarged and when the axis becomes into this area, then it will be reflected on ECG. So what really happens is that the ECG is telling you the direction. ECG should always be correlated with the clinical findings. Degree is to know कि आगे क्या होने के chances are. हाँ, exactly. That's why, so sometimes, we say, do you have old reports? What if I say, chalo, right? Your hemoglobin is 11.4. 11.4. Normal or abnormal? Can't say. What if your hemoglobin before 3 months, it was 9? And now you are started taking supplements and you are excellent and this is 11.4, so I'll be telling shabash, very good, right? But what if your hemoglobin was 14 and then it has dropped to this? So then I'll say, okay, we need to investigate, right? Is there any occult bleeding? Because why it has dropped so much? So this number itself doesn't make any sense. It is like a snapshot. At that point of time, what is the hemoglobin? So accordingly, one can say, but this is the correct method. We need to either, if these reports are not there, then we need to take the history. So similarly, in this case, when you find that old ECG and this new ECG is showing any of the shift of degrees, you need to ask the history. You need to ask the history which is related to pulmonary hypertension. And if it is deviating towards this side, then you have to ask the history for the systemic hypertension. You see the ECG, immediately you take the blood pressure. You'll find because systemic hypertension, you know that it will be affecting the left ventricle, while pulmonary hypertension will be shifting it on this side, and that is what you have to ask for. Right? Immediately you watch his feet. Are the feet swollen? Right? Is there any edema? Press it and release it. Pitting edema. Yes, that means his right heart is involved. Right? So that is how you coordinate. Okay. So now we start with the third degree. Till this point of time, we were talking about x-axis and y-axis. Now we are adding the third degree. Right? So it is like z-axis or the z-axis. Right? So this is how to draw. Right? So this is like it. Right? So we were dealing with x-axis, we are dealing with y-axis, and now we are dealing with this z-axis. That is the depth we are taking. Okay. Drawing it symbolically. Right? So normally we draw the heart like this. Right? This is left ventricle, thick musculature. This is right ventricle, thin musculature. And then the whole thing is chest. When we put the, and this is the center line. Right? So as such, heart is in center. Left ventricle is projecting slightly more towards the left side. So our V1, lead V1, which are placed on the chest, right? Which are placed on the chest. So this is V1. Then comes the V2, and then it will go all the way up to this extreme, right? So this is where it is V6. So we have got V3, V4, V5, and V6. So this is V3, V4, V5, and V6. Right? Very simple. V6 is watching from the lateral side. Right? So it will be watching simple left ventricle. You know? So this is what it will watch. Even V5. So we just pair them like this. Right? So this would be watching the lateral aspect. Then V3 and V4. That would be watching the anterior aspect. And V1, V2, they are classically meant for AV septum, atrioventricular septum. Now, why this atrioventricular septum? In order to understand this thing, you have to just watch it like this. That is, when we draw the heart like this, it is like this. This is the this is the right atrium. Front is the right ventricle. Over here, it is the left ventricle, and left atrium is behind. So when we are watching, when we are placing the lead over here, this is the V1, V2. In fact, it is this septum which is giving us the sharp line which is parallel to V1 and V2. So they'll be watching straight away this particular septum. Right? So am I clear? Right. So just remember V1, V2, AV septum, V3, V4, anterior, and V5, V6, the lateral. Importance. Whenever things will start going wrong in any of the leads, that means you'll be knowing that, let's say, as I explained you, that there is, say, ST segment elevation. When there is ST segment elevation, this is the sign of myocardial infarction, heart attack. So that particular area is getting less blood. If that particular area is getting less blood, in which lead are you watching? If you see that thing in V1, V2, that means you know that this is an infarction of AV septum. If it is happening in V3, V4, V3, V4, that means it is watching the anterior of the heart. Anterior of the heart is what? Anterior of the heart is right ventricle. So that means you know that this is the myocardial infarction of right ventricle which is in progress. If it is happening in V5, V6, that means V5, V6 is later. That means it is this side. That means it is the infarction of left ventricle which is in progress. Right? It is. Am I clear so far? Any confusion? Because then we'll start watching the X-rays. I'm X-rays guy, ECGs. Which left atrium? Left atrium is a rarely anything happens to left atrium. But yes, in case if it happens, so for that there is a special electrode which has to be swallowed. Which has to be swallowed, it goes, see, because for that we need to draw it like this. Right? This is the left atrium. Just behind the left atrium there is esophagus. So you have to go for the esophageal electrode. So that esophageal heart, transesophageal probe. So that goes inside and then it takes, and then you will see. But say instead of doing this much, I would go for the MRI. That will show much better. And when you'll understand the MRI now, you'll find it's easy, because MRI is like, all you need to understand is, if you know the correct reason of that high tide and low tide, right? In ocean, right? There is high tide and low tide. If you know the principle, you have understood the MRI principle. It is that simple. But just the interpretation part, that is where the nuclear science comes into picture. But anyway, this part is good, great, all right. So let's move further. Okay, I'll keep all images, not erasing anything. So precordial leads, now they are clear to me. The next one, this is the only principle which we have to understand. Right? In cardiology, they talk lots and lots of things about R transition and S transition and kuch nahi. Simple, ek rule. Start with S. Start with S. Now we start with it. This is already known to you. SA node, AV node, these are the internodal, right? This is the Buckman's bundle, this will go to left atrium, this will go to right atrium, and then we have got the right bundle and the left bundle, and then there are Purkinje fibers, right? All. One question which I asked you before, in I think first or second session, that this is the P wave, this is Q, R, S, and then the T. When the current is coming exactly into this direction, why this negative deflection? Why this negative deflection? It should never be negative, no? Because the current is coming. If the current is coming, this should always be positive. This is P, right? Then why this Q? The reason behind it is the game is into this area. It is into this area. Now in this area, imagine over here there is more muscle on the left ventricle side. Over here there is less muscle. There is less muscle. So this is what will happen in case of Purkinje fibers, right? Over here, so then there will be all Purkinje fibers, right? They will be going, right? There will be Purkinje fibers and it will come. But when it comes to septum, right, this is what this portion would be interventricular septum, the septum which is present between two ventricles. For this, the resultant current goes like this. It goes like this. Why? More current is over here, and then from here it goes like this. More current over here, then it goes like this. More current because more muscles. So there would be the transverse movement of the current. If you really calculate the resultant vector, so that vector will go towards the negative side. It will go towards the negative side. So though the current is moving into this direction, but because of the septum in which it is going into the transverse direction, you get this short negative. Again, no one would ask, but this is good to know so that you are clear in your brain that from SA node, it starts clearly into positive direction. In AV, it is going to right atrium, it is going to left atrium, and then it goes towards the septum. And then as soon as this septum this is complete, and then the whole thing, it starts going into the form of Purkinje fibers. Okay. Next, we were talking about the transition. Now, R is rise and S is sink. Right? So this is Q. R is rising and S is sinking. Two important waves, R and S. Right? R is rising and S is sinking. All the way, we now draw it that V1, V2, V3, V4, V5, V6. All the way from V1 to V. We said start with S. So that means situation will be like this. This would be S. Then as will be moving towards the V3, V4, things will become something like this. This would be R is rising, S is sinking. Right? And as we'll reach, it would be like this. So this is the R. That means we'll start our journey with the S wave and we'll end our journey with the R wave. Right? And this whole thing is called as the transition. Transition. I'll show you. Here it is. See, over here. This is V1. Right? So here it is S wave. As it approaches V3, V4, it becomes quite similar, and then finally to this went up. Right? So here it is. This is R becomes from. This is the pattern. This is the pattern. This is what is called as the precordial transition. So either you take it like, say, how the R goes, right? How the R goes, or the S goes. So, but basically it is the V4 where R is equal to S, isoelectric. Correct? So this is how the electrical signals will be moving. This is what will come to that. So going back to this part. Is this part clear? All right. Next one. Hypertrophy. Whenever we are dealing with ventricles, so there is increased muscle mass, so we'll be calling it hypertrophy. Hypertrophy means higher voltage. When there are higher voltage, so that means there will be the bigger spikes because there will be bigger vector. Right? Bigger vector, there will be more electrical activity. Right? When it comes to atria, in atria there is less muscle mass because walls are thin. They don't have to, they are not dealing with, we have already seen that, right? They are not dealing with a very high pressure. So that's why they are called as the atrial dilatation. So atrial dilatation. So that's why we'll be calling it left atrial enlargement or right atrial enlargement. So it is RAE or RAE, right? Atrial enlargement. So that's how it really goes. So this is one. Second, this is the SNO. SNO is sending signal to right atrium. And via the Buckman's bundle, it is also sending the signal to left atrium. Right? Now this is very interesting. Right atrium and left atrium via Buckman's bundle. So when it comes to right atrium, when they both are normal, right, and you are watching from here, so signal will, you will see that signal is going to right atrium, right? So it will generate, signal has started from here and it is going like this. So it is coming towards the electrode, right? So it will be giving plus, and again the signal over here also it is going, but it is of related vector is this, right? So there would be this P wave. So thus you have got the P wave, which is a combination of right atrium and the left atrium, which is called a combination. And both of them, they are occurring together. So that's why the resultant vector is this resultant vector. Right? It means that everything is in balance. Now tell me, if this is left atrium is enlarged, when left atrium is enlarged, that means there would be delayed atrial depolarization. That means the current is still going into the left atrium, right? So that means this axis would deviate. It will go towards that side. That means it will cause a negative diffraction. So it would be like this, and then it would be like this. Correct. This is what is called as the biphasic. So biphasic, this is because of the right atrium, and then the signal is still going towards the left atrium. So that's why this second half would be for the left atrium, because left atrium is far, right? So via Buckman's bundle it is going. So this is, we'll see the example. When they are in sync, everything is fine. So then both the things, they are occurring together. But when it is left atrial enlargement, the right atrium has done, but left atrium is still sending the signal. So that's why it is dipping, because it is going away from our electrode. When the vector is this, then we get this. When the vector is this, it is going away, so we get this negative refraction. Right? Everything occurring in real time. And who will be watching it? Whosoever is in right in front. So this is something which will watch in V1, V2, right? In all these things. And V2 is very important. Okay. Next is for the atrial enlargement. The question which you asked is the ECG so important? Right? This is I think fourth or fifth session. Yeah, it is important, because this is normally the weakest area of it. They usually don't give this importance, but it will be so helpful for the rest of your life. Atrial enlargement, coming back to this. Atrial enlargement, we said that this is the biphasic way, right? When we say this is biphasic. So biphasic P wave, right? We are dealing with P wave because P wave is for atrial. We'll be watching it into V1 because V1 is straight away watching it. Right? So this is This is the right, and this is the right, and then this is the left, and that's how it is going. Normally, it is not seen like this, but only when it is enlarged. So how do you know that it is enlarged? Now I'll draw it. When we draw it like this, you have to measure this distance. It is called as right atrial enlargement. When the P wave, the first phase of the P wave, is more than one small box, more than one small box. Right? When it is like this, right, when there is left atrial enlargement, situation would be like this, and then this. It would be like this. We'll see the example. We'll show you. Right? So this is the left atrial enlargement. Same principle when the P wave, but it is the second half. Right? Second half, it is more than one small box. Right? This is the first half. First wave or first half. First half. Right? Second. To this, you know that, right? This is the question. In lead 2, P wave, if it is more than, if you don't have any other, if it is more than 2.5 small boxes, so invariably, right, you can see that this is the atrial enlargement. Now, left atrial enlargement, in which case it can occur? Commonest, mitral stenosis. Right, mitral stenosis. Right. This is the left atrium. Here is the mitral valve. Right. Mitral valve is stenosed, so left atrium has to struggle, so that's why it will become bigger. Yeah, biphasic wave occurs. This is the reason. This is where I show you that when it is normal, then there is only one factor, right? When this left atrium is enlarged, so see what happens. The current comes, right? And when then the right atrium has finished its current, right? Because right atrium was having only this much, but because left atrium, it has got now more muscle as compared to right atrium. So current is still going. So because this resultant factor will be going away, so that's why it becomes negative. Right? That's why it becomes negative. So that's why you get this pattern. And this pattern itself is called as the biphasic, in which there are two phases. One is up, second is down. One has to be up because this is right atrium, which is near, right? And left atrium, it is far. It is going on the opposite side. So that's why it is down. This was one of the questions, so don't forget about this, that it is the lead 2, in which the P wave is more than 2.5. I have got the example also. If it is more than 2.5 small boxes, and in this case, it would be shown as a spike. It will be shown as a spike. Right? The P wave will be like this, and then the QRS complex will be like this. So this is a typical pattern, and it is the monophasic. Monophasic means it is only into one direction. Something which is called as a P pulmonary. You will see that. But this much is what you have to remember. Okay, we can now from this point onwards, right, still there is so much of stuff to show. So we can do one thing, we can stop at this point. Next time we'll be completing the ECG. Right? I'll upload this file, and next time I'll start from this point onwards. But next time we'll surely finish it. Right? So what I expect is revise everything properly, so that all these conditions, right, there are some amazing conditions, right? All these, though these are you have just for excess deviation. But see this part. This part is what we have to watch. Sharon, I uploaded at the same link of that. Do one thing, send a mail to me. Send a mail to me at this address. I'll send you the link. It is TILLURBS@gmail. Echocardio, so it is a huge. I'll need 2 months. But all those, right, principles of echocardio, where I'll show you the real images, not only the real images, but even the conditions, so that you can enjoy it. Right? So echocardio, even this ECG, what we learned, right? I should say this is about 5%. About 5%. Echocardio is when you are using the sound waves to detect the movement of the heart, right? Not only the movement of the heart, you'll be able to see the movement of the cusps. And your anatomy will become so powerful because you'll be having a very clear 3D visualization. I'll show you even the angiographies also. Right? So that coronary angiography, once you have understood, it will be very easy to diagnose. Right? It is more advanced. What? Echocardio? Yeah. Advanced to kya? It is a continuous learning process. I am learning. Right? So, yeah, it is like you know more and more new things. Is that perspective develops. So next time we'll be completing it. I'll just upload this file right now, revise it properly, and then next time we'll finish it so that we can start with a newer one. Today is the first day. From where can I get the uploaded file? Jessica, send a mail to me on this address. Because if it is your first day, then yes, I can understand. You'll find it pretty challenging. Oh, so many new persons there. Chirag, for you also it is first day? Because I think this is, I think we are having these lectures since 3 months. है ना, 3 महीने से पढ़ रहे हैं ना तुम लोग. Lecture timings change because in the morning, so many people are first time. But like during cardio, my heart rate stays around 120, 130. 130 is fine. Don't worry much. Okay. See, those who have joined for the first time, right, send a mail to me. Right, I'll send you the link. You just go through those files because we completed general physiology, then we completed the entire respiratory system, and then we started with the cardio. In cardio also we took some of the topics, then the ECG we took, because now it's like we are on the verge of starting with the say congenital heart disease, or we'll do one thing. We'll take the embryology first. Embryology is how the entire heart forms. So even those who have joined for the first time, right, for them it would be much easier because they will get that perspective, the link, and then we'll be going for the congenital heart disease. Don't worry. All right. So thank you so much and take care. See you soon. The lecture timings have been changed from morning to this part because morning time there were so many students. They were telling that they were having university lectures, right? So it was overlapping. That's why we changed it. Okay. So take care. It is on every alternate day, right? So it is on Tuesday, Thursday, and Saturday. So now we'll be meeting on Thursday. Which last part? I don't mind repeating. Tell me which last part? Last part means is it this? This is no problem. No. See here, this is right atrium, this is left atrium. Over right atrium and left atrium. Entire game starts with SA node, right? SA node, sinoatrial node. This is our pacemaker from where the current starts. That current, it goes to one point, and this is what is called as the AV node, atrioventricular node. So from here, it will go towards the ventricles, right? But we are interested in things before that. Some fibers they will be supplying to right atrium, and then there is a big fiber which will be going all the way to the left atrium, which is called as the Buckman's bundle. Buckman's bundle, right? It is called as the Buckman's bundle, and this Buckman's bundle will be supplying. So here it is. This is the Buckman's bundle, and this is which is going towards the right atrium. When things are normal, so then one wave and the second wave, because the current is going towards both the sides, so the resultant vector would be this. Right? So you get this proper one single wave. When there is enlargement, so that means current is still constantly going on that side. The current over here is finished, right? Let's say it is 2 units, but over here it is 8 units. So 2. So for initial part this much, initial part this much, and then because the current is going on the opposite side, that's where there will be the negative diffraction onto our ECG lead. Right? This is what is called as the biphasic. Biphasic. Right? We'll see some examples also of this biphasic. Okay. So thanks a lot and see you soon.